Greetings all, this is Miss Gibson. We're going to be discussing community health. Some of your objectives can be found on this PowerPoint. What is community health? What are the essential components to community health? What principles guide community health? What are factors involved in community health education? What are the elements of disease promotion and prevention? And last is, what are some practice areas included in community health nursing? Community health nursing, the definition that your ATI book gives is population-focused approach to planning, delivering, and evaluating nursing care. Community health nursing is a broad field. It allows nurses to practice in a wide variety of settings. It also promotes the health and welfare of clients across the lifespan and from diverse populations. This is all on page 3, chapter 1 of your ATI. Community health nursing essentials. Some things that we'll talk about is factors that influence someone's health, which are your determinants of health. Some things that we'll discuss is nutrition, stress, environment, finances, education. All of these things will affect their health as well as their health outcomes, whether they are obtaining the proper health care that they should be. Are they able to eat and get the food that they need for proper health? What is their education level? Did they finish high school? Are they able to read? Those are the things that community health nurses need to focus on. Some health indicators. We're going to describe the health status of a community, the mortality rate of that community, the disease prevalence. Is lung cancer prevalent because there's factories in that community? Levels of physical activity, obesity, tobacco use. All of those are used to develop targets for improvements in community health. So what is community? Community can be defined as a group of people and institutions that share a geographic, civic, and or social parameters. It varies in their needs and characteristics. So a community health nurse is a nurse who practices in the community. They usually have a facility from which they work, but they aren't limited to institutional settings. They can be delivered in settings such as home, school, workplace. Public health nursing, this is focused on population health, promotes health and prevents diseases, or the disease process, not diseases, forgive me, with an emphasis on primary prevention. Their goal is to work to achieve the greatest good for the largest number of people. Principles guiding community health nursing. You have ethics, which is concerned with protecting, promoting, preserving, and maintaining health, as well as preventing disease. We're going to advocate, which means the nurse will play the role of the informer, supporter, mediator for that client. The nurse must place priority on the client's values and wishes. We will also use evidence-based practice. This is just the use of best practices when delivering patient care. We will also use quality research to base our actions when we're providing that high quality care. And nurses can be involved in new research studies to add to the body of knowledge already available. So nurses should always be willing to put forth any kind of expertise or experiences that they have come across in their healthcare journey or while they've been a clinician to help improve evidence-based practice. And then quality assurance, quality improvement, and quality management are used in community health, just like in an institutional setting. Then you have professional collaboration and communication. Nurses facilitate communication between the client and other providers. And then nurses should use clear language with a respectful tone. You got to understand most of the time the patient is not well. So, depending on their educational level or where they might be in regards to their disease process, we've got to use that clear, clean cut language and make sure that we're not screaming at them or we're not talking too loud, because that can make them uncomfortable, and then they're not as likely to learn or absorb the information like they should. Community health education, the purpose of this is to promote, maintain, and restore the health of different populations. We got to consider certain barriers to learning, like age, educational level, any kind of language barriers or cultural barriers, and then lack of motivation. A lot of the role of community health nurse is education. We have to be willing to educate. That's the whole reason that the community health nurse functions in a manner just like we talked about back here, with that clear, clean cut language, respectful tone. That way we know that our patients are absorbing the material the way that we want them to, and hopefully they're going to understand it a little better too if we are coming across in an appropriate, respectful manner. Next is health promotion. The nurse plays an active role in helping people change their lifestyle to attain better health. Things like health education, immunizations, taking preventative medications, lifestyle changes. You even have some screening programs. Some of the things that I want to talk about with health promotion is in your ATI book, the Healthy People National Health Goals are derived from scientific data and trends collected during the prior decade. So these goals are based on those issues that are considered major risks in the health and wellness of the United States population. So the Healthy People guidelines look over things such as quality measures for high quality outcomes. It guides the nurse in developing health promotion strategies to improve individual and community health. It was initiated in 1979, and every 10 years it publishes the National Health Objectives that serves as a guide for promoting health and preventing disease. This Healthy People promotion is coordinated by the United States Department of Health and Human Services, along with federal agencies, and then it just transitioned to Healthy People 2030 in August of 2020. So that's just something important to know, that Healthy People, it's a national goal to help with this health promotion. Pretty important stuff. I want you guys to think about what some of the screening programs might be, that the community health nurses might use. Think about, when you're thinking about the health promotion, some of the screening programs that I can think of within community health would be things like when they check girls for scoliosis. Those could be screening programs. And then most of your community health nurses are trained in giving immunizations to your peds population as well. And then they're going to educate on lifestyle changes as well as health education, which is very important. So, with disease prevention, we know we have primary prevention, secondary, and tertiary. So, your primary, this is you're going to prevent it before it ever happens. It's going to go over things like nutrition, family planning, smoking cessation, safety education, immunizations. Sorry, let me go back. My goodness. Your secondary, this is screenings for cancer, diabetes, hypertension, TB, community assessments, disease surveillance regarding your communicable diseases. And secondary is just early detection as well as treatment of the disease to limit the severity. Your tertiary, this is nutritional counseling, physical therapy, support groups, and this all refers to recovery after an injury or illness. So those three are very important within the community health nursing realm. And there is a in-depth discussion or intro to these three disease prevention steps on page 8 in your ATI book. Community health practice areas, you have home health. Within home health, providers care to clients where they live, maybe in their home, could be an assisted living or even a nursing home setting. Home health nurses must be aware of their own safety. Remember that you are a guest in their home. Work is part of an interprofessional team, including nurses, PT, OT, sometimes home health aides, social workers, and dietitians. Hospice, this focuses on enhancing the quality of life using palliative care and supports patient family through the dying process. Hospice care can be completed in several different areas: home, assisted living, nursing homes. Occupational health focuses on promoting health and preventing occupational injuries. This goes back to your work comp cases, work well, those kind of facilities will is what they're referring to with occupational health. Then you also got faith community nurses. This is your missionary nurses, and then school nurses. And then last but not least is your forensic nurses or your SANE nurses. They're going to get called in to any patient that has been assaulted, and they can do sexual assault exams. Usually they work within a hospital setting. And that is it. If you have any questions, please don't hesitate to reach out.